Welcome to this explainer. Look, if you or someone you love is staring down the massive, frankly overwhelming landscape of Los Angeles rehab options right now, I want you to just take a deep breath. Navigating substance use disorder treatment is incredibly stressful, especially when you're suddenly flooded with complex medical terminology and this giant maze of facilities. Today, we're going to clear away that confusion. Think of me as your guide sitting right across the table. We are looking directly at the crucial choice between inpatient and outpatient treatment, and we're going to unpack exactly what each pathway means so you can make the absolute best, most informed decision possible.
To get us there and help reduce some of that anxiety, here is our roadmap for today. We're going to cover 1. The recovery crossroads, 2. Inpatient versus outpatient care, 3. Finding the right fit, 4. Inside residential treatment, and finally, 5. The iRely difference. All right, let's start with Section 1, the recovery crossroads.
Okay, let's dive into this. Choosing a treatment path is literally one of the most critical decisions you'll make in this journey, and honestly, it is perfectly normal to feel the heavy weight of it. It's the core dilemma everyone faces right out of the gate. Which rehab pathway is actually better? Well, the truth is, both offer completely legitimate routes to recovery, but they are fundamentally different. We're talking different structures, different intensities, and vastly different levels of clinical oversight. So it's not really about which one is universally best, it's about which one is the right medical and lifestyle fit for the specific needs of the individual.
Let's get our terms straight, starting with outpatient rehab. This is exactly what it sounds like. You receive treatment, but you continue living at home. The key words here are flexibility and independence. You might attend sessions anywhere from a single hour up to 20 hours a week, depending on if it's a standard program or an intensive outpatient program, often called an IOP. Now, this path is fantastic for those who have mild to moderate needs, incredibly strong home support systems, and a strict need to maintain a job or stay in school. But keeping that independence also means you're still navigating your evenings and weekends out in the real world with limited supervision.
In stark contrast, we have inpatient, or residential rehab. For this one, the defining words are structure and immersion. You actually move into a therapeutic facility for 30, 60, 90, or sometimes even more days. We're talking 24-hour medical supervision, on-site psychiatric support, and a constant, unwavering clinical presence. For anyone dealing with severe substance use disorder, complex medical needs, or simply a history where outpatient attempts just haven't worked, this immersive environment is an absolute game changer. It completely removes the individual from their daily triggers, so literally 100% of their energy can go into healing.
Let's move to Section 2 and see how this builds as we compare the paths directly.
We really want to reduce the cognitive load here and break these paths down so you can see exactly how they stack up. First, let's look at the daily schedule and those tricky triggers. On the outpatient side, you get that flexible scheduling. You pick appointment times that fit your daily life. But the major trade-off? You remain in the exact same environments where the substance use occurred. That means triggers are a constant daily battle. Over on the inpatient side, your days are highly structured. From group therapy and medication management to meals and wellness programs, everything is planned out for you. This is so crucial because it practically eliminates decision fatigue. You don't have to wake up and figure out how to avoid triggers because the environment is literally engineered to remove them.
Second up is medical supervision and detoxification. Outpatient programs can handle mild withdrawal symptoms, sure, but they just aren't equipped for severe detoxification. Inpatient facilities, on the other hand, manage all levels of detox right there on site. You have nurses and physicians continuously monitoring vital signs. They can administer and adjust critical medications like buprenorphine or naltrexone in real time based on exactly how the patient is responding. It's just a vastly higher safety net.
Third, let's talk psychiatric care. In outpatient, you're generally looking at weekly or maybe bi-weekly psychiatric visits. So, if a crisis hits on a Tuesday night, you're kind of on your own to seek out emergency services. But inpatient care provides daily psychiatric evaluation and immediate, on-the-spot crisis support. For folks with a dual diagnosis, which means a substance use disorder layered with a mental health condition like severe anxiety or bipolar disorder, this daily, immediate intervention isn't just a nice perk, it's an absolute clinical necessity. And this brilliantly illustrates the clear dichotomy between the two. Outpatient relies heavily on the individual's existing environment and their own self-management, making it a great fit for lower acuity situations. But inpatient provides a completely new, controlled, and highly resourced environment to stabilize and treat those higher acuity, more complex cases. Keeping these core distinctions in mind is going to make this next part much easier to grasp. Section 3, Finding the Right Fit Using ASAM Clinical Criteria. So, you might be wondering, how do medical professionals actually decide which path is the right fit? Well, they don't just guess, they rely on scientific matching criteria from the American Society of Addiction Medicine, or ASM, which advocates for a really smart stepped care continuum. The idea is that most people facing severe challenges benefit immensely from moving chronologically through these steps. It starts with Step 1, medical detox, to safely stabilize the body. Once stable, you move into Step 2, residential treatment for 30 to 90 days to rebuild those critical psychological foundations. Then comes Step 3, aftercare, which slowly reintroduces independence, ultimately bridging you to Step 4, full community living. It's a highly structured visual pathway that gradually scales down the support as the individual builds up their resilience.
Now, within those ASM guidelines, we find very specific designations, like ASM Level 3.5. This refers to clinically managed high-intensity residential care. It's explicitly built for severe substance use, multiple co-occurring conditions, or cases where previous, less intensive treatments just haven't done the trick. This level requires rigorous structured care and intense psychiatric oversight. And it's precisely at this high-intensity, specialized level where premier facilities like iRely Recovery operate.
Which brings us to Section 4, inside residential treatment. Now, what's really interesting about this next part is we get to see how this works on the ground.
Let's shift from the textbook theory to everyday practice and use iRely Recovery as a tangible case study. The philosophy driving a facility completely dictates the quality of care you receive there. Just look at this quote from Vincent Franke, the CEO of iRely Recovery. He says his model was designed specifically to eliminate the gaps in care witnessed at other facilities. And this isn't just slick marketing copy. Franke built this approach backed by 21 years of experience operating 31 different treatment centers nationally. He saw firsthand exactly where traditional models were falling short, mostly in staffing and response times, and he engineered a facility explicitly to solve those exact problems.
To see how they did it, look at this number. 5. That is the minimum number of years clean and sober required for every single licensed clinical therapist at iRely. Think about the profound empathy and the deeply personalized attention that brings to the table. You aren't just talking to someone who read about addiction in a textbook, you're talking to a licensed professional who truly, deeply understands the journey from the inside out. Plus, this team is supported by a UCLA-trained addiction psychiatrist and 3 licensed nurses available 24/7. It's an exceptionally low staff-to-client ratio, intentionally designed so that literally no one ever has to wait for support during your crisis.
And that leads us nicely into Section 5, the iRely difference.
So the crucial point is really the granular daily methodologies they use, specifically something called the continuous therapeutic response model. Unlike outpatient settings where you might only check in once a week, or honestly even some inpatient settings that are just overly rigid, iRely assesses patients continuously throughout the day. Say an individual's having severe cravings in the morning. Their therapist might schedule an extra impromptu session for that very afternoon. If a medication clearly needs tweaking, the psychiatrist evaluates and modifies it that same day. It's all about making real-time proactive clinical adjustments, rather than sitting back and waiting for subtle shifts in mood to snowball into major problems.
And this real-time response is paired with a highly diverse daily schedule. We're talking an integration of therapies like CBT, DBT, family sessions, and mindfulness. But the glue holding the whole shebang together are ROSC principles. Because, let's face it, the medical world absolutely loves a good acronym. ROSC stands for Recovery-Oriented Systems of Care. It emphasizes that recovery isn't just some final destination you arrive at after a 30-day stint. Instead, it frames recovery as an ongoing, evolving process of growth, building peer support, and finding real purpose in life. It's a completely tailored approach, not just a one-size-fits-all factory line.
Well, we've covered the crossroads, we've compared the paths, and we've taken a deep look inside a top-tier facility. You now know the profound difference between the flexibility of outpatient care and the rigorous, deeply empathetic immersion of inpatient care. So the final question you need to ask isn't just about what's available out there, it's about what's medically and personally necessary. With this knowledge in hand, are you ready to take the step that actually matches the reality of your journey? Thank you so much for joining me for this explainer. I genuinely wish you clarity, health, and strength on the road ahead.